DSM-5 defines dissociative fugue disorder as purposeful travel or bewilderment wandering that is associated with amnesia for identity or for other important autobiographical information.
My name is Peyton Miller, and this is my story. I decided to enter the National Guard 2 years ago. I had heard stories of National Guard units being deployed, but I thought perhaps I could avoid service. I really didn't know if I was prepared to go to war. But I got the call, and they told me I was going to Iraq. For 2 years, I served my time, and then I came back home and tried to return to my old life, but nothing felt the same. One day, the stress of it all was apparently too much to handle. They say I went missing, but I don't really know what happened.
An individual diagnosed with dissociative fugue disorder experiences amnesia, a lost sense of identity, a sense of being in a dream, distorted sense of reality or time, and a fugue state with purposeful travel from the home or place of work.
Some causes include history of amnesia from epilepsy, head injury, or alcohol abuse, history of psychiatric disorders, i.e. depressed mood, distal stressors, severe precipitating stress from a variety of sources, anywhere from job loss to natural disasters or even being in the military. Another important thing to consider when discussing causes is patients who have previously experienced amnesia and later become depressed are more likely to develop associative amnesia accompanied by a fugue state if faced with severe stress.
I just didn't know what to do. He left in the middle of the night, and when I called him the next day, he didn't pick up. He didn't answer his text messages, and I had no idea where he was. It's really hard not knowing where someone you love is, and I just didn't know what I was going to do. So when it had been about a day, I called the police station and filed a missing persons report. When they found him, they called me and told me that they'd found him. And they said that he was in a state of amnesia, and when he saw a picture of me, he kind of remembered who he was and snapped out of it a little bit, but he still didn't know where he was. I take him to therapy now, and he's been to see the doctor, but he's not quite better. It's just really hard having someone that you love so very much not be okay and not be with you and not necessarily remember everything you've done together. But I think we can get through this.
Because dissociative fugue is so rare, the prevalence of it is 0.2% of the population. It ranges in percentage in different countries, but still remains low. 42% of clinicians claim they have never even seen a case.
Hi Peyton, how have you been?
Been alright.
Yeah? How are things going? How's the family?
Family's alright. I'm doing okay, trying to piece my life back together.
Still just adjusting?
Definitely still adjusting, trying to fill in the gaps.
Yeah? Everything else feel alright other than that? How's your anxiety doing now?
I had the Paxil.
The Paxil, how's that working for you? Have you noticed any difference?
Not
That was
really.
about 2 weeks ago that we started that.
Yeah, I haven't really noticed much of a difference.
That's totally natural. You know, it's an antidepressant, selective serotonin reuptake inhibitor. So what those do is they usually start to take action within 2 to 4 weeks. But it needs to be in your system first before you start to really notice the difference. So
Alright.
keep being persistent and just wait. You gotta be patient, but you seem
I'm
like
hopeful.
you're doing good with that.
Yeah.
And your psychodynamic therapy sessions with Dr. Lewis?
Dr. Lewis, yeah, he's a really nice guy.
So you're still seeing him?
I'm still seeing Dr. Lewis. I'm hoping that I can sort of regain some normalcy. But definitely a little bit confused about
what do you
what
mean by
happened.
normalcy, maybe?
I just want to,
piecing it back together.
yeah, I kind of want to understand what happened a little bit more. Hoping that he can
Good.
help with that.
Treatment typically includes a phase-oriented psychotherapy to treat dissociative fugue and dissociative disorders. Stage 1 emphasizes stabilization, focusing on emotional regulation and symptom control. Stage 2 includes identifying and processing traumatic memories, while Stage 3 concludes with reintegration into life, focusing on future life issues and goals.
Hello, Payne. How are you?
I'm alright. How are you doing?
Good. After looking over your EEG test results, we've determined that you're suffering from dissociative fugue, which is a type of dissociative amnesia. Usually this occurs after a traumatic experience. It says here you served in Iraq for 2 years. Can you tell me anything about that?
Yeah, you're right. Served in Iraq for 2 years. Got discharged a couple months ago. I guess it's been hard returning back to my old life.
And did you receive any type of counseling upon your return?
Not much. They referred me to some sort of counselor that I could talk to, but I didn't really see him that many times.
Well, usually dissociative fugue occurs when you don't receive the proper counseling and you don't give yourself enough time to adjust.
Treatment can also include a neuropsychological exam. Medication is not used as primary treatment, however, when used, it can be helpful for treating anxiety and comorbid conditions. This medication includes SSRIs, tricyclic antidepressants, and benzodiazepines. Hypnosis can also be used as treatment.
Well, luckily, Payne, with the right combination of medication and therapy, we can expect you to see some improvements.
Treatment efficacy is found in that 90% of people who had a dissociative disorder stated that psychotherapy is most helpful when treating their disorder, and 60% rated medications as also helpful. The use of both psychotherapy and medications has been found to increase the effectiveness of treatment. It is hard to quantify because many people have already snapped out of the fugue state and actually need more assistance in coping.
Although Peyton has survived a horrible time in his life while at war, he has to face another war at home. The stress of being back so soon and not being under constant fire and turmoil has left him not knowing how to cope. His girlfriend and family are glad the local authorities were able to find him, for it has been known that with dissociative fugue, in extreme cases, people will go hundreds of miles and adopt complete new identities. Peyton was lucky and is now on the road to recovery.
If you have any of these symptoms, do not be alarmed, but you may be suffering from dissociative fugue or another comorbid disorder. There is help. Talk to someone you trust and seek your local psychologist.